I would like to give you a glimpse of telemedicine as a form of online consultations with use of phones, SMS, virtual conferences, or through telecommunications with your healthcare provider or your physicians in order to make decisions, healthcare options, and to provide treatment for your condition at a distant site. Hi everyone, I am Cunanan, a medical doctor from the Philippines. We were all struck 3 months ago when we were placed under enhanced community quarantine. We stayed in the comforts of our home just to be safe. Free medical consultations were given by medical practitioners and physicians during the enhanced community quarantine to lessen the ER consults, to support the participation in the enhanced community quarantine, and to decrease the surge in health facilities. Coming with telemedicine as the new normal, online consultations are now being done through virtual conferences or through phones. I would like to give you a glimpse of telemedicine as a form of online consultations with use of phones, SMS, virtual conferences, or through telecommunications with your healthcare provider or your physicians in order to make decisions, healthcare options, and to provide treatment for your condition at a distant site. Of course, there is still no better way to assess or diagnose your patient because face-to-face interaction is still the gold standard clinical care. Due to the crisis that we are experiencing at the moment, telemedicine is encouraged for assessment, for diagnosis, and treatment of diseases, except for those that need physical contact or those medical emergencies that need to be treated in the emergency rooms. So there are different platforms in which a patient can use telemedicine for check-up. The following are made from the Department of Health, hospitals, and different physicians in order to cater for their patients. So an appointment is needed prior to the virtual conference itself. So there are hotlines or cell phone numbers or Facebook pages that you could call or you could use in order to set an appointment. So these then are used for different primary health concerns with different specialties which caters for both COVID and non-COVID related diseases. So the following are the Facebook pages that I'm talking about which you could use in order to set an appointment for telemedicine or online consultation. So other platforms from the web browser or phone applications are being used by different healthcare physicians such as OnLogin from BizBox, Zoom meetings, Microsoft Teams, Medify for doctors, Consulta-MD. So these are the different platforms in which you could be redirected after an appointment that has been set. So the consult still simulates an ideal hospital or clinic setup wherein the doctor does still the standard clinical care and the practice of medicine except the physical contact. So the consult is done in a quiet environment with the patient or with the relative in converse with the physician. So upon agreement and explanation of the terms and condition, an informed consent is obtained from the patient. The information that is provided during the consultation for assessment, for diagnosis, for therapy, or for follow-up will be encoded in an electronic medical record by the physician. So it safeguards the information of the patient. So any form of communication between the patient and the physician shall be protected with confidentiality and utmost integrity to ensure integrity against intentional or unintentional information breaches under Data Privacy Act of 2012. So after which, an electronic prescription, home instructions, or follow-up will be given to the patient. It also depends on the physician if she or he wants to refer the patient to another doctor for evaluation and management, or refer the patient to the emergency room department if needed. After which, payments will also be dependent on different platforms such as online banking, GCash, or Paymaya. Always remember that after receiving treatment from telemedicine, the patient still has to do a follow-up to the primary care doctor after the pandemic. So that's it for this episode. I hope you learned a thing or two from this video. If you like it, please give it a thumbs up. If you have any comments, suggestions, or questions, please feel free to comment down below. Share this video with your loved ones, subscribe to my channel, and see you on my next video. Stay safe everyone, bye!